Hello, my name is Dr. Darren Hollander. We're here in my office, Orlando Family Chiropractic, and I just wanted to talk to you a little bit today about arthritis and what it is, because it's a term that's used a lot. And if we can actually break down the meaning of the term, then you can learn a little bit more about arthritis, how it can affect you, and also how chiropractic can help arthritis. The term arthritis, artho refers to the word joint, and then itis refers to inflammation. When you have an inflamed joint, we can call that arthritis, and that can cause pain. And so, when we're treating arthritis, we want to see, how can we prevent this joint inflammation? And what we found, in the literature and in clinical practice is by having joints that are moving well are usually not an inflamed joint. And a joint that isn't moving well will make bony changes, or what we call arthritic changes, that can degenerate the spine or really any joint and cause a lot of problems. So I'm just going to go over some illustrations to show you, how these bony changes can happen and how they can affect the spine and your health. So for instance, in the spine, I'm just going to draw a vertebra. You have the vertebral body, you have the disc, and another vertebral body. And here's, the center of the disc. And in the back of the spine, we have the spinous processes. And then, going behind the vertebral joints, we have the spinal cord. And then in between the vertebral joints, we have spinal nerves. So this joint is meant to be moving. It's supposed to be moving, and it needs to be moving to be healthy. When it loses its proper range of motion, and in the spine, you can lose that range of motion on one side or both sides. You lose that symmetrical range of motion. Your body will respond to those stresses on those joints by laying down bone. So you might lay down more bone on one joint than another. And when that happens, you can create a phenomena, that we refer to as bone spurs. They're literally like thorny projections that are coming from the vertebra. And depending on where these things form, they can interfere with different processes. So the bony projections could be interfering with the facet joints behind the spine, with the spinal cord itself, or it can even occlude, this area where the spinal nerve is exiting. If this joint gets stuck, and when we say stuck, it means subluxated. When that joint gets subluxated, it loses its proper range of motion, the stresses on that joint changes, and bone will begin to be deposited in an asymmetrical fashion. When you get adjusted by the chiropractor, we restore that normal range of motion, and the opposite can begin to happen. If you've had degenerative changes happen to your joint or your spine, we can reverse that process by restoring that proper range of motion. And if the joint in your spine is moving, it's less likely to be causing inflammation and less likely to be causing you pain. Going to the chiropractor can help prevent arthritis, can help prevent these bony changes by keeping your spine and your joints moving well. It can help reverse arthritic changes in your spine, and it can help reduce pain by reducing that inflammatory component. If you think that you might suffer from arthritis, or if you suffer from arthritis and you haven't tried chiropractic yet, I'd really encourage you to do so, because there's a good chance it could help.